given 90 seconds to read questions 1 to 6. Good morning. My name is Sally Perkins and I'm one of the registered nurses working here at the hospital. Very soon I'm going to highlight the importance of immunisation and medical treatment for tetanus infection by talking about some case reports. But first I'd like to give you a little background on the disease. Tetanus is caused by a toxin produced in bacteria found worldwide in soil, dust and manure, and it can contaminate many surfaces and substances. Because of this, the disease cannot be eradicated completely, but infection can be prevented through immunisation with tetanus toxoid containing vaccines. People who contract tetanus and recover do not have natural immunity, so they can be reinfected and therefore also need to be immunised. To be protected throughout life, the World Health Organization recommends that an individual receives 6 doses of a tetanus toxoid containing vaccine, which can be done through a routine immunisation program. Tetanus is characterised by painful muscular contractions and spasms. Involvement of the muscles of the jaw and neck has led to tetanus also being known as lockjaw. It's not directly transmitted from person to person. Instead, the bacteria enters the body through a cut or wound. The majority of patients develop the disease as a result of a deep wound or puncture, but even a tiny pinprick or scratch can be enough for the bacteria to enter the body. Although tetanus cases are much rarer than they used to be, tetanus is still a life-threatening disease because of inadequate vaccination levels and inappropriate wound care. Another major issue is that only 1/3 of people who have a tetanus-prone wound actually seek medical treatment. One of the main reasons given by people for not getting tetanus vaccine is that we already have high levels of naturally occurring antitoxin through unintentionally ingesting the tetanus bacteria in day-to-day living, granting natural immunity without ever needing a single dose of medication or vaccination. Others state that if you've potentially been exposed to tetanus, fully cleaning the wound will reduce the potential for bacteria to enter the bloodstream. The problem with these approaches is that if you've been infected and aren't aware of it, medical treatment may come too late. Now I'd like to present some case studies to illustrate the danger of taking tetanus protection for granted. First, the case of a 45-year-old woman who lives on a farm and sought medical care after experiencing leg, back and jaw pain, although she had no specific injury. Because the woman was also having difficulty breathing, doctors had to do a tracheotomy and put her on a ventilator. After 2 weeks in intensive care, the patient faced weeks of physical rehabilitation. In all, the woman was hospitalised for 6 weeks of medical care. Because the symptoms were recognised early on and because the woman hadn't completely stopped breathing, she was able to make a complete recovery. She had not received a regular tetanus booster shot and the status of her primary vaccination was unknown. The second incident I'd like to share with you occurred when a 4-year-old boy was taken by his parents to the GP with a 1-week history of general malaise, mild fever, lethargy and weight loss. He subsequently developed dysphagia, difficulties opening his mouth and dehydration. Due to the concerns about the boy's refusal of fluids, the paediatrician was consulted. The boy then began to show signs of lockjaw and muscle rigidity. Together with the lack of immunisation and a toenail infection, this finally led to the diagnosis of tetanus. The boy was then transferred to a paediatric intensive care unit for initial treatment. Initially, the frequency and severity of his muscle spasms increased during the day in ICU, but he did make a full recovery after 4 further weeks of treatment. The final case involves an otherwise healthy 53-year-old man who arrived at the emergency department of his local hospital complaining of severe stiffness in his jaw and difficulty swallowing, but without any apparent wounds or cuts. Following an exhaustive examination and attempts to alleviate his symptoms, a diagnosis of tetanus was made by the medical team. He was treated with tetanus immunoglobulin and tetanus toxoid and kept unconscious for 2 weeks. The man was discharged after spending nearly a month in hospital, including his nearly 3-week stay in the ICU, and he was not able to recall the date of his last tetanus vaccination. I'm sure you'll agree this case highlights how everyone is at risk of the disease.
You hear an interview with Dr. Delia Amin, who was Team USA's Chief Medical Officer at the Sochi Winter Olympic Games. You now have 90 seconds to read questions 1 to 6.
So, Dr. Mean, what did being CMO mean?
Well, it meant overseeing 77 other healthcare professionals and taking care of 228 U.S. Olympians. As a CMO, I worked in tandem with a team to deliver the highest level of care to our athletes. We were using the latest technology, evaluating a mix of treatments to ensure peak performance, and were ready to respond to whatever might have come our way. It also meant working long and busy hours during the games, where the team faced everything from common colds and illness to traumatic injury. And it also meant having compassion and understanding while applying your medical expertise in a fast-moving environment.
Can you give me a behind-the-scenes description of what the medical support of the athletes looked like?
Yes, absolutely. Well, it looked pretty much like any medical clinic you might be familiar with. There were dozens of boxes shipped to Sochi so that we were able to care for our athletes. Our doctors saw everything from coughs and flu to sprains and breaks. As a result, we had a comprehensive team assembled to address whatever health-related need might have come through the door. We looked like a mix of care providers such as athletic trainers and physical therapists or chiropractors and massage therapists to assess and provide the best solution to the problem. Our goal was to have our athletes back on the slope, track, or rink as fast as possible, performing at their peak.
I see. And who cared for the athletes if there was a life-threatening injury?
Well, if a situation like that had arisen, and I'm very happy to be able to say that thankfully it didn't, the intervention of doctors, specialists, and emergency providers from the Olympic Organizing Committee and our Team USA doctors would have absolutely been vital. We always had one of our physicians with the team during training and at competitions at the various sites. That gave us the flexibility to provide immediate care should the situation have occurred. We felt pretty confident that through our collaborative efforts, we could care for our athletes in just about any situation.
Well done. And how did you approach injury prevention?
Preventing injuries was certainly a major part of the support we provided. Aiding athletes and coaches to condition appropriately and prime their bodies with good nutrition and recovery efforts while in Sochi was all part of the whole care that we provided while we were there. We were able to use technology to assess and evaluate our athletes to ensure they were at their peak to perform. The travel and extreme competition did take a toll on the athletes' bodies, but we did our best to keep our athletes healthy in every respect.
And were there any new technologies used by the US medical team in Sochi?
Well, one of the tools we used was a groundbreaking form of software which provided our physicians and athletes the ability to communicate health information instantaneously and securely. The software maintained diagnostics, treatment evaluation, which provided our physicians and athletes the ability to communicate health information instantaneously and securely. The software maintained diagnostics, treatment evaluations, and test results, and it was all accessible virtually. This was especially critical when we were traveling from venue to venue in a foreign country. I have since actually implemented this same software in my private practice. Now, no matter who is involved in the patient's care, the healthcare professional has easy access to all the critical information and can respond accordingly. We also had several ultrasound machines that we traveled with, which was an incredible diagnostic tool for many musculoskeletal injuries.
And finally, how might other young physicians follow in your footsteps?
Well, I would encourage any physician that aspires to this kind of appointment to begin connecting with officials in their area of interest. My work with the U.S. cycling team helped build my reputation among other elite sport organizations, where I was able to establish relationships and convey my interest in working with them. You know, it can take a lot of time volunteering, but the work is invigorating and stimulating because you learn so much in the process, especially if you're passionate about it. I really do believe I am a better physician and surgeon because I've had the chance to work in these various situations. I can bring that experience back to my private practice, which elevates care for everyone.
Listening Part C. You hear a nurse called Sally Perkins giving a presentation on tetanus to a group of hospital trained